Well, there's a number of VADs here on this table. This is the HeartMate 2 VAD, or Ventricular Assist Device. And what this does is acts as essentially like an artificial heart, which takes over for the left ventricle. So there's a few here on the table. This is an older device here. This is called the HeartMate 1, which is we no longer use as much. And this is an exciting device, and this is the same kind of device that past Vice President Dick Cheney has. It has two specific uses. It can be used as a bridge to heart transplantation, and it can be placed for destination therapy. And what that means is that this device is permanently placed in the patient. There are some patients, a number of patients who've had this device in for more than 4 years, and there is one patient in the country that's had it for more than 5 years. So it's really a long-lasting, durable device. This is an older an older version of that device called the HeartMate 1. It's still an option. However, this HeartMate 2, as you can see, is much smaller. It's easier to implant, and it's a continuous flow device where you don't actually have a pulse after the device is implanted, but patients do very well with it. This portion of the device is connected to the patient's left ventricle, and the blood is taken through here and is pumped through this device and up to the aorta. So it essentially is in parallel to the body's native circulation, but it takes over for the left ventricle. So really, your left ventricle is not really squeezing at all during after this is implanted, and this is doing all the work for your heart. What we're looking for patients to be helped with this technology are patients who have essentially end-stage heart disease. So they're patients that we would normally consider for heart transplantation. So they're patients that have heart failure or weakening of the heart muscle that's so severe that it's very difficult to do really anything. It does involve an incision in the chest. It does involve going on the heart-lung bypass machine. In the best case scenario, patients can be discharged from the hospital in a week to week and a half.